So I'm going to be performing the skills portion of my injectables checkout video. I do already have a verified MAR. It was verified by Caitlin Ryan. Alright, so before I get started, I'm just going to perform a quick hand hygiene. Okay, so I am starting at the Pyxis. According to my verified MAR, my patient's name is Manny Stickens, date of birth is 12/15/48, MRN number 000-73421. He is a 64-year-old male and he is allergic to penicillin. So today I'll be administering his 0900 medications, injection medications, as well as a PractiTub PPD skin test that is ordered to be given intradermally now. Alright, so now that we are at the Pyxis, I will be taking out the medications that we need. So first, the demo dose of 0.8 mLs. This is a 2 ml demo dose ampule. So we have more than enough. Expiration date is 2/20/29, so it's all good to use. Next is our insulin R of 7 units. We have a 100 unit insulin R bottle. So we have more than enough. Expiration date is 2/20/29, so it's still good to use. Next, we have an insulin N of 14 units. We have a 100 unit bottle insulin N, so we have more than enough. Expiration date is 2/20/29, so it's all good to use. And then lastly, a PractiTub PPD. All right, we have a 1 ml PractiTub PPD bottle, so we have more than enough. Expiration date is 2/20/29. Perfect. So now that we've completed our first medication verification, we are now going to move over to the nurse station. All right, so now that we are at the nurse's station, I'm going to perform a quick hand hygiene real quick. And I will be putting on some gloves since we will be measuring out the medications. All right, so we are going to perform our second medication verification check. We have a demo dose of 0.8 ml. We have a 2 ml demo dose ampule right here. Expiration date is 2/20/29. So that's good to use. We have an insulin R for 7 units. I have a 100 unit insulin R bottle, so we have more than enough. Expiration date is 2/20/29. We need an insulin N for 14 units. We have a 100 unit insulin N, so we have more than enough. Expiration date is 2/20/29. It's all good to use. And lastly, we need a PractiTub of 0.1 mLs. Here we have a PractiTub of 1 ml, so we have more than enough. And expiration date is 2/20/29. All right, so now that we've completed our second medication verification, we are now going to measure out our medications. So we'll start with the demo dose. So first we will need to gather our equipment. We're gonna use a 3 ml syringe. Here's our 3 ml syringe. And then I will also be using a filter straw. And then I'll also be using a 22 gauge 1 1/2 inch needle. And then I'm going to use a measuring cup and an alcohol swab. All right, so first I'm going to flick the ampule just so that the medication is all at the bottom. Just like that. All right, so now I'm going to take my alcohol swab and I'm going to put it under, or I'm going to take my ampule and then I'm going to open it away from me, just like this. And I'm going to throw that into the sharps container. Next, I am going to be using my 3 ml syringe. I'm going to be connecting it to my filter straw. And then I'm going to be careful not to touch the sides of the ampule, but I'm going to be withdrawing all of the medication into my syringe, and then I will measure out the excess later. Okay, so now I'm going to unattach the filter straw. I'm going to attach my syringe to the needle, just like this. Just gonna push that up just a little bit. All right, so now I'm going to uncap it, and then I'm going to measure out 0.8 mLs of demo dose. Just gonna flick for bubbles. All right, so we have 0.8 mLs of demo dose. All right, so I'm going to safely cap this. All right, so I'm going to just put that aside for now while I create my label. So I'm going to create the label using a triangle method. So I'm going to write the name, demo dose. I'm going to write the dosage, which is 0.8 mLs. And then I'm going to write intramuscularly, and then expiration date is 2/20/29. I am going to wrap this around my syringe, but I'll be careful not to cover the plunger. All right, so here is my label. It's not very pretty, but it says demo dose 0.8 mLs intramuscularly, expiration date 2/20/29. So that's all ready to go. All right, so I'm gonna get rid of this in the sharps container. Next, I'm going to measure out the insulin bottles. I'm going to first roll the bottles out. And then I'm going to take 2 alcohol swabs. I'm going to clean the tops of the bottles for 30 seconds each. All right, it's been 30 seconds. All right, and it's been 30 seconds. Okay, so for this one, we are going to use a 29 gauge 1/2 inch needle. We're going to use an insulin syringe. There we go. All right, so what we're going to do is we're going to first uncap it. And my bottles are prepped and clean, so that's good. We're going to pull out 7 units of air first. And now we're going to pull out 14 units of air, so I'm going to bring the plunger all the way down to 21. There we go, 21. So first I'm going to go to my insulin N, and I'm going to inject 14 units of air into insulin N. All right, I like to be exact. Next, I'm going to inject the remaining air into insulin R. Now I'm gonna invert insulin R, and I'm gonna pull out 7 units of insulin R. Okay, that's 7 units. Now I'm going to insulin N, and then I'm going to invert, and I'll be pulling out 14 units of insulin N. So I'm just gonna pull the plunger all the way down to 21. Perfect, exactly 21. All right, so there are no bubbles. All right, so I have exactly 21 units total. I have 7 units of insulin R as well as 14 units of insulin N. Here we go. I'm going to safely cap it. Okay, so now that I've measured that out, I am going to cover it up first for a little bit. All right, so I'm going to use the triangle method. And I'm going to write out insulin R and insulin N. Insulin R has 7 units. Insulin N has 14 units. And they both expire 2/2029. Alright, so I'm going to wrap this around my insulin syringe, but I'll be careful not to cover the plunger. Alright. Here's my label. Insulin R has 7 units, insulin N has 14 units, and the expiration date is 2/2029. So my insulin is ready. All right, so I'm gonna walk this back over to the Pyxis because it is a multi-use bottle. Lastly, I am going to measure out the PractiTub PPD. I'm going to clean the top of the bottle for 30 seconds first. All right, it's been 30 seconds. I'm going to be using a 1 ml syringe. It's a 27 gauge 1/2 inch needle. All right, so for this one, I'm gonna uncap it first. I am going to be pulling out 0.1 mLs of air. Okay, so now that I've pulled out 0.1 mLs of air, and it's all clean and prepped, I'm going to inject 0.1 mLs of air into the bottle. I'm going to invert, and then I'm going to pull out 0.1 mLs of air. Good. All right, I'm just gonna flip because there's a bubble. All right, and now there is exactly 0.1 ml of PractiTub PPD. Now I'm going to safely cap it, just like that. All right, so I'm just gonna put that aside for now. I'm gonna write my label. I have a PractiTub PPD, and I have 0.1 ml as my dosage. We'll be giving this intradermally, expiration date 2/2029. Okay, here's my label. PractiTub PPD 0.1 mLs. We'll be giving it intradermally, expiration date 2/2029. All right, so we have measured out all of our medications now. I will be walking this over back to the Pyxis because it is a multi-use bottle. I'm going to remove my gloves, and then I'm going to perform hand hygiene. I'll be heading over to my patient's room next, but before that I will be make sure to gather my medications. All right, I'm gonna grab some alcohol swabs, some gauze. Okay, and then I'm gonna grab some new clean gloves, and these are new clean gloves. All right, now let's head over to the patient's room. Knock, knock, knock. Hi, my name is Yasmin. I'm gonna be administering your injection medications today. Before I get started, I'm just gonna perform some hand hygiene real quick. Performing hand hygiene, washing my hands, and then I will be putting on my new clean gloves. All right, so I am at the patient's bedside. Let me just gather out this. All right, so I am going to make sure I take his armband and put it directly on the MAR so I can compare it. Make sure we have the right patient. We have Manny Stickens. Date of birth is 12/15/XX. Age 64, MRN number 000733421. And I see you have an allergy band. What are you allergic to? Penicillin? Okay, and what kind of reactions do you get? Hives? Okay, thank you for letting me know. So we have verified the right patient, and we have verified if they have allergies. All right, so now we're gonna perform our third verification medication check. So we have a demo dose of 0.8 mLs. Here is our demo dose of 0.8 mLs. We'll be giving that intramuscularly, expiration date 2/20/29. We have our insulin R and insulin N. Insulin R has 7 units, insulin N has 14 units, expiration date 2/20/29. And then we have our Pratitub PPD of 0.1 ml. Here's our Pratitub PPD of 0.1 ml. We're going to be giving that intradermally, expiration date 2/20/29. Okay, so now that we perform our third verification check, we are now safe to administer the medications. All right, so first we will be administering the demo dose. We'll be administering this on your right arm, on your deltoid. So your deltoid is right by your shoulder. We're gonna put 3 fingers on your acromion process, or below your acromion process, which is right here. And then below your 3 fingers is where the injection site will be. So it'll be right here. So I'll place my left hand on your right arm and put 3 fingers, and this is where the injection site should be. I'm going to clean that site with an alcohol swab, and I've assessed it and there is no redness or swelling in there, so it's safe to administer on this site. Just gonna clean it first. I'm gonna wait for it to dry. All right, so because we are giving this demo dose intramuscularly, we will be going at a 90-degree angle. I will make sure to use the Z-Track method, and I will make sure to aspirate. So I'm gonna remove the cap. I'm going to use the Z-Track method, so I'm gonna pull the skin, I'm gonna pull the skin firm. I will go at a 90-degree angle at the site, and then I will make sure to aspirate. So here we go. I'm gonna go at a 90-degree angle. I'm gonna make sure to aspirate, and then I will make sure, and then I will insert in the medication. I'm gonna pull it out. All finished. All right, so I'll make sure to apply some gentle pressure. So you will feel some soreness at the site for a few days, but make sure not to scratch it or irritate it. I would just leave the site alone for a few days. But yes, you will feel some tenderness or some soreness. But there's, that should be it, but just make sure not to itch it, okay? All right, so now that we applied gentle pressure, we're done with that. Next, we will be doing the insulin medication. So for the insulin, I have chosen the left lower abdomen. So I'm going to test the site real quick on the left lower abdomen, 2 inches away from the umbilicus. I'm going to pinch the site, and it looks like I can pinch more than an inch. So I will be going at a 90-degree angle. Let's see. All right, so we are 2 inches away from the umbilicus on the left lower abdomen. I'm going to clean that site real quick. All right, I'm going to wait for it to dry. All right, so with this, because I can pinch more than an inch of the subcutaneous tissue, I will have to go at a 90-degree angle. Okay, so I'm going to uncap. I'm going to pinch the subcutaneous tissue. I'm going to go at a 90-degree angle. I'm going to release the skin. I'm going to insert in the medication, and then I'll pull out the injection, and it's all done. I'm going to apply gentle pressure again, and then you will feel some soreness or tenderness, but make sure not to irritate it by putting hard pressure or itching it or irritating it. Just, I will leave the site alone for a few days, okay? All right, so now that it's all done, I administer that on the left lower abdomen, 2 inches away from the umbilicus. All right, lastly, I'm going to administer the PratiTub PPD, and this is going to go on the patient's left arm, on the ventral surface of the arm. All right, so I am taking the patient's left arm. I'm going to clean the ventral surface of the left arm, just like this. All right, so for this medication, I will be going at a 5 to 15-degree angle. I will make sure that my bevel is up. All right, so now that it's dried, I am going to make sure my bevel is up, which it is. I'm going to pull the skin taut, just like this. And then I'm gonna go at a 5 to 15-degree angle. I'm gonna insert the needle so that it's an 1/8 inch into the skin. Make sure the bevel is covered. Now that the bevel is covered, I'm going to insert in the medication. All right, and I do see a wheal or a bleb. So now it's safe to gently pull out the needle. And I'm gonna throw that into the sharps container. I will not apply pressure on this arm. Do not put pressure on this arm. Do not itch it. Do not try to scratch it or anything. I would just leave the site be. And in 48 to 72 hours, make sure to have your arm read by a nurse to find out the results, okay? Do you have any questions? No? Okay. So I will make sure to give you your call light, lower your bed down. I'll make sure that you are safe. And if you need anything else, please let me know. I'm going to remove my gloves. I'm going to perform some hand hygiene. All right, so now I will head over to the nurse's station because I've administered all the medications I needed to do. I'm going to cross out the medications that I administered. So the demo dose at 0900, I'll initial beside it. I gave that on the right arm, on the right deltoid. And then the insulins I gave on the left lower abdomen. The PratiTub I also administered at 0900. And then I did that on the left arm. I'm going to sign my name. Initial. And then I'm all finished.